Hey everyone, I'm Diane Sawyer with the Reedsville Chamber. Welcome to another edition of our Topics at 12. Today's series I have with me Sonia Henderson, who is with Hendlee CPR and Safety Solutions and also Hendlee Home Care. We are so excited to be learning about heart health and learning about why it's important to be CPR certified in your business. So take it away, lady.
Okay, awesome. Thank everybody for taking time out of your busy day to come learn a little bit about CPR. I was out earlier on the streets just a little while ago and offering somebody the chance to come in here for a free CPR workshop. And her response to me was, "I'm too busy." And my question back was, "Have you ever had CPR before?" And she replied, "No." And so I was like, "So if you're too busy now, what if when you get home, somebody's having sudden cardiac arrest when you get home?" And she was like, "I don't know." I said, "Well, here's a chance to, come to this workshop." So CPR is vital for everybody, not just businesses, individuals, everybody. It's a life skill. So as a business, you get to share this with your employees, and also they take that skill home. So I'm going to go a little bit into some AHA statistics about sudden cardiac arrest, and then we're going to go through some demonstration, hands-on demonstration of CPR. So sudden cardiac arrest is basically an electrical malfunction of the heart. It's not the same thing as a heart attack. They're two different things. One can cause the other, but they're not the same. So you can experience a heart attack, which usually is, think about it as plumbing, like clogged plumbing. And that can, of course, trigger sudden cardiac arrest, which causes the heart to go crazy with its electrical impulse. So sudden cardiac arrest is the leading cause of death in the U.S., killing approximately 350,000 people annually. Okay? 70% of those sudden cardiac arrests happen at home, not in the hospital, but outside of the hospital. So learning CPR is important because if you're going to use it, the chances are you're going to use it on somebody that you know, meaning a loved one, a friend, somebody that you know, because most of the time it's going to happen outside of the hospital environment. So by learning bystander CPR, which is what we're going to do today, we're just going to learn the hands-only version. There are two versions of CPR, which I'll talk about a little bit later. You greatly increase the person's chance of survival. So if sudden cardiac arrest happens, if bystander CPR is administered immediately, then that person's chance of survival doubles or triples. So that's why it's so important for everybody to know how to do CPR. All right, so I have a little entertaining video about sudden cardiac arrest.
Hello, I'd like to tell you about... Oh, didn't expect that.
Hey, sudden cardiac arrest occurs when the heart stops beating properly. Sudden cardiac arrest is an electrical problem caused by an abnormality in the heart's electrical system. The heart's pumping action is disrupted, and the heart can't pump blood to the brain, lungs, and other organs. Seconds later, the victim collapses suddenly, appears lifeless, and is not breathing, or is abnormally gasping for air. You may see several seconds of seizure-like symptoms.
Hello?
Not true. Cardiac arrest can happen to anyone, anywhere, anytime. Although more commonly seen in those who have heart disease, cardiac arrest can also strike those with no history of heart problems at all, and can be caused by recreational drug use, electrocution, or even a sudden blow to the chest. Sudden cardiac arrest is the leading cause of death in many countries, and its survival rate is less than 1% worldwide. No, cardiac arrest is not the same as a heart attack. Think of a heart attack as a plumbing problem. It occurs when blood flow to the heart is blocked. Victims of a heart attack are still conscious and may complain about symptoms such as shortness of breath or discomfort in the chest. In contrast, cardiac arrest victims need help right away. Every minute without help means the chances of survival drops by 7 to 10%. That leaves only a golden survival window of only 10 precious minutes. So better get moving.
Cut!
Okay, so as you can see from that short video, I told you before, they're not the same. And as we witnessed earlier in the year, that sudden cardiac arrest can happen to anybody. We saw on national TV, while watching football of all things, a young man who should have been in tip-top shape, tip-top health, go into sudden cardiac arrest. And it was probably likely that hit jarred, his heart and, distorted his heart rhythm. So just think about it, like you have kids that are playing sports, or even let's say we're walking around, maybe somebody bumps into you real hard or you bump into something. That could be a triggering factor. You never know. So that's why it's so important for somebody to know CPR and to be able to administer it quickly. So most people don't know what CPR stands for, and it's cardiopulmonary resuscitation. And basically, it's a way to restart the heart if sudden cardiac arrest occurs. So there are two types of CPR. There's hands only, and then our traditional CPR with breaths. Today, we're going to concentrate on hands only CPR. There's evidence out there that hands only CPR is just as effective because when sudden cardiac arrest occurs, the heart still has blood in it. So by you operating, doing chest compressions, you're distributing that blood, that oxygenated blood around to other organs. So that's why hands only is very effective if you administer it right away. So this day and time we have COVID and other things where people are less likely to, perform like breaths. But there are also like barrier devices that you can use, like this one, which is a face shield. You can buy these and pop it open like that, place it over the victim's nose and mouth, and you can give them breaths, and it provides a barrier for you, as a layer of protection. Because me personally, like if somebody I really know and love is, experiencing sudden cardiac arrest, I want to give them breaths. And I will do it anyway because I'll use this. So when I have these classes, I tell people you might want to be prepared. You might want to purchase something like this, or even I have a little gift for y'all today. That's a.
My husband used to have one on his keychain.
Gotcha.
Exactly like that.
So. Here I have you all a gift. So this is a one-time use barrier device. And so save it. I'll show you what it looks like.
Thank you so much.
Excuse me.
Oops, sorry.
Hold our hand. Don't open it. I'm gonna show you what it looks like because it's.
I just wanted to see him.
Did anybody else need one? Who else needs one?
I passed mine around.
You did.
Passed her. Yeah.
Okay.
Thank you.
Thank you very much.
Oh, this one's got some string on it. There we go.
Thanks.
Okay, so basically, this is just, like I said, a little face shield to use in an emergency. Pluck it out, open it up. Looks like this. It tells you how, this is the top. Tells you what side goes on the face. There are some little ear loops. And this little hole is where you would align it with the person's mouth, and you blow in and blow out if you were giving somebody breaths. And then, of course, you would toss it. So, like I said, they're kind of, I didn't want you to open it up because it's a headache trying to fold it back together and stuff it in here. Yeah. So with hands only, they're just 2 steps, real simple. Call 911 and start the compressions. and to compress hard, deep, and fast. So today you're going to get to see how it feels to actually do the compressions on, not, of course not a person, but it has a little recoil in here. So it lets you know how hard you've actually got to press on like a real live person. Some people, they have no idea unless you actually do some hands-on practice of how hard should I be pressing,
They used to have Recess Annie. That's
Yeah.
what they called her.
Yeah. So, you definitely have to go kind of hard. When I've run like CPR classes, a lot of people don't press hard enough. And these mannequins here, they have feedback devices on them. So they're going to let you know if you're going hard enough at the right pace and rhythm. You'll see some lights on there, and I'll cover that in just a minute. So I know earlier you had a question about when do you begin, CPR. So basically the steps of performing CPR, first you want to make sure that your scene is safe, that it's safe for you to do anything. Because let's say you walk up and you see somebody laying down, maybe they're just taking a nap, maybe they're laying down because of something else in their environment, maybe they got shot by a nearby wire or something. So you want to make sure that it's safe before you engage in CPR, because the last thing we want is two victims, Already got one person down, we don't want to have two. So if you've checked your scene for safety and it's safe for you to begin CPR, you want to check for responsiveness. And this is usually done by tapping on the shoulders. Hey, are you okay? So you would be tapping Joe Blow here. Hey, are you okay? Are you okay? If he does not respond or show any sign of life, no movement, no breathing, no flinching, you don't see chest rise and fall, then you would go into doing the chest compressions. Shout for help, call 911, and start CPR, basically. So that's the whole sequence there. So I made sure my scene was safe. I checked for responsiveness. He's not responding. I'm shouting for help. Hopefully somebody's around the corner and this doesn't have to stay a one-person rescue. And then either you yourself, if you're alone, call 911, or somebody else comes on the scene to assist you with that. So you'll keep hearing, like, check the scene for safety, and these are some examples of what that means. Like if there's some smoke around, maybe the person is down because of smoke inhalation or something. Maybe there was a gas leak, you walked in and this person is laying down. They walked into the lunchroom and was having break or something. And maybe there was a gas leak. You walk in, you smell something that smells like rotten eggs. Okay, so that's something, checking your scene for safety. You want to make sure there's no risk to, your own self. And these are some of the things like risk of explosion. Maybe the building is unstable, or maybe they fell down and they're on like an unstable surface. And if you start doing CPR, you might collapse down to the ground or something like that. So you want to make sure that it's safe. So the next step of CPR, if the scene is safe, let's see how much y'all were paying attention. Scene is safe, what's the next thing we're going to do?
Shout for help.
The scene is safe. we walked in, he's laying down, the scene is safe. Hey, are you okay? Are you okay? Because, it could be somebody that's taking a nap in the park or something, and they just laying there. And if we, do the tap and shout, that usually should arouse them. So check the scene for safety, check for responsiveness. And then we're going to move on into shouting for help and calling 911. So we've been through all of that. In that as well. So now let's talk a little bit about chest compressions. So chest compressions are the most vital part of CPR. So you want to put your hands basically in the center of the person's chest. You putting your heel, the heel of your hand right smack dab in the center, and lacing the other hand over top. And then you're basically gonna press down, operating as a lever. You're not like plunging your arms like this. You're just gonna bend at your hips. And one way to know if you're in the center of a person's chest, we can use our armpits as a landmark. So if you use your armpits to come around, you'll be smack dab in the center of that person's chest, no matter how large or small, breast development, whatever, that'll put you where you want to be. And speaking of breast development, there's a statistic out there that women are less likely to get CPR because people are afraid of exposing the chest and things like that. So when it comes to doing CPR and using the AED, then we need to have a bare chest, and some people are afraid of exposing a woman's chest. So, don't be afraid. For that day, it's okay.
It's
Look,
okay. You
I
just
don't,
say that's all I'm
you
saying.
get your peep show for that day.
We come to this world naked, we may go out naked.
Yeah,
So-
might have to.
Yeah, that's right. You get your
So
peep
what
show.
about on children?
On children, I typically cover that in like one of the certification classes. So if anybody's interested in doing like a full certification class, we'll do adult, infant, and children. But with the child, it's pretty much the same as the adult. You just might not want to press with two hands. You want to adjust the amount of pressure according to the size of, of the child. But everything is going to be the same. So as you can see here, the rate is about 100 to 120 compressions per minute. So there you can keep the song like Staying Alive in your mind. Yeah, 100 to 120. So basically one to just keep a rhythm in your head. But do whatever you have to do to keep that rate, because you don't want to compress too fast, because then you're not allowing the chest to, the heart to fill back up with blood before you press it back out. So you're defeating the purpose of CPR if you're pressing too fast. And of course, if you're going too slow, you're not getting that blood around as you need to those vital organs. You want to go about 2 inches deep. Okay, so real life, nobody's going to be, this looks 2 inches. So you just want to go hard, deep, and fast. If you hear some cracking and crunching, you know you're going 2 inches deep, right? It's not uncommon to break ribs when performing CPR. So don't let that deter you. You're worrying about hurting somebody. I would be more hurt if I'm dead versus you doing CPR.
You can come get out broken rib.
That's right. I can recover from a broken rib.
Yeah.
And then there's the Good Samaritan law, right? So there's a Good Samaritan law. You're trying to help somebody, so you don't have to, worry about that, assisting somebody in a crisis, and you did your best. So with chest compressions, you also have to allow, like I said, the chest to come back up and recoil and fill back with blood before you press it back out again. So we're going to practice that in just a little bit. We're going to practice doing 100 to 120. These mannequins are going to let us know if we're doing that. They have the lights, and they're going to let us know if we're going deep enough. So basically, we want to get 2 green lights, if y'all saw that. Now, might have went away. Now he's dead. If you get red, we got a problem, okay? So real quick, before we move along, let's talk a little bit about AEDs. AED stands for automatic external defibrillator. And they may look different ways. I have 2 examples here. So this is one type, looks this way. This other one has like a shield on it, and this one doesn't have batteries in it, so we're not going to use this one today. But if you open it up, it's supposed to power on and you start using it. So the main thing to remember about an AED is to cut it on. Cut it on. It's going to tell you exactly what to do step by step. So cut it on. And I'm going to.
Does it tell you exactly where to place?
It does. We got pictures.
Okay.
We got pictures on here. So almost foolproof, usage. So if there's an AED on site, then get it, use it immediately, because that's going to be the thing that restores that person's heart rhythm the quickest and hopefully brings them out of cardiac arrest. So
Adult patient.
you just cut it on.
If
That's
the
the green
patient
button.
is a child, press the child button.
This particular one has a child button, but these are
Remove
adults.
clothing from the patient's chest. Remove packet and apply pads onto patient's bare skin.
So we got the little pictures here.
Apply pads as shown in the pictures. Press pads firmly on skin. Press pads firmly on skin. Do not touch the patient.
Now at this point we will be saying all clear.
Do not touch the patient. Analyzing heart rhythm. Shock advised.
That's telling you shock
Do not
advised.
touch the patient. Everyone clear.
And you make sure everybody's back.
Press the flashing shock button. Shock delivered. Begin CPR.
So now it's going to tick. So basically you would be doing your compressions, following.
10,
It's keeping count for you.
And that's how fast you should be pressing?
That's your
20.
rhythm you want to keep.
30. Give 2 breaths.
And if we were giving breaths, you would give 2 breaths. But if you're doing hands only, you're just going to keep going through all of this. Just keep going.
That's cool. Like that's
10.
cool, but it keeps keeps you on track. I
Keeps
like
your
that.
rhythm. Yeah.
Yeah, you can download some apps on your phone that will have, I think it's called like a metronome that will keep count for you, that ticking. You can do that. Like I said, keep the song staying alive in your mind. There are other songs too. You just can go online, Google like CPR songs, 100 to 120 beats per minute.
That sounds fast because it's 2 per second, right? 120 would be 2
I told you you're going to go hard, deep, and fast.
You're right.
You're going to go hard, deep, and fast.
Are the AEDs very expensive?
They are.
Yeah, I was just looking.
Yeah, they're kind of expensive. There's some programs available for different organizations to try to help them get them, but they're a little bit on the expensive side. But when you look at it, a life versus the expense of an AED,
Right, yes.
yeah. So, like I said, they might look a little bit different, but the whole operation is the same. No matter what kind of brand, cut it on, follow the steps. So now that you know how vital it is to, use an AED, so pay attention, in your comings and goings, in your worship places of worship, in your fitness facilities, the grocery store, wherever it is that you're going, kind of, be alert and aware so that if something happens, if you saw it, you can run get it while that person's administering CPR. Okay, so basically, like I said, the most important thing is to cut it on, follow the prompts, apply the pads to bare skin, not if I have a nice underwire bra on that comes off, whatever, cut it off. I'm okay with that. And to stand clear. So even though the device will say, stand clear, you should verbalize that as well because, some of us are not paying attention. Not listening, things are in the heat of the moment, so you want to also verbalize stand clear. And then press the shock and begin compressions.
This might be a dumb question, but why do you say stand clear? What are the consequences if you don't?
Because we don't want you to get that extra shock.
Okay.
Yeah, so we only want the person that's supposed to get the shock to get the shock.
Okay.
Okay. So, getting shorter on time, so let's do some practice. Y'all ready to practice?
Sure.
Y'all sure you're ready? Okay. All right, so I'll show you real quick. Like I said, that's kind of how you want to place your hands. And then when we're doing the compressions, we're just going, usually if a person goes unconscious, you want to do CPR on the floor. It's not likely that they're going to go unconscious on the table or whatever. If they're at home, But for today, we're going to do it on the table. But real life scenario and like certification classes, we do it on the floor.
Would you move somebody into a position if they were not?
Yes, you
So
would.
if they're in the bed, we need to pull
If
them
they're
to
on the
floor.
bed, you put them on the floor.
You
Yes.
need that pressure behind you.
Yeah, I was gonna say.
Yes, because that bed is going to be given, and you're not going to get that. So if they're on the bed, you put them on the floor. Whatever, slump over in the chair, put them on the floor, and that's the way we want to operate. So, okay, so let's run through the CPR sequence. Of the first step is what's that?
Make sure that you're safe.
Making sure a scene is safe. Second step,
Check for responsiveness.
Okay.
and then the next thing we're going to do, they're not responding.
Shout for help.
Yep, shout for help, call 911, and then go ahead and begin CPR. So when you're, so if they're not responsive and there are some other people on the scene, you want to assign the role of who calls 911 and who gets an AED. And the reason why you want to do that is because sometimes people get bystander effect. They're going to be standing around, or now these days they're taking out their phones, recording.
Oh, dear Lord.
Yeah. So you want to say, even if you don't know the person's name, hey, you in the tie, you call 911, you go get an AD. Just make eye contact, point them out, or if I got a red shirt on, you in a red shirt, you go get the AD. So that multiple people are not flooding the 911 system, calling 911 for the same, incident, and that you're bringing a call to action. Somebody's going to call 911, somebody's going to run get the AD, and somebody can go ahead and do CPR. So make sure you assign the roles and then move forward. And then I always tell like children and youth groups with hands only CPR, y'all all can take a turn. So we've got all these people in the room. If you give out, then the next person can go ahead with hands only and just go ahead and start with the compressions. So hopefully you can keep that person alive until more advanced help arrives. Okay, so right now we're just going to practice compressions, and then we'll practice putting on the AED and then doing a few compressions. Sound like a good enough plan? All right, let's see. Y'all put you one on that side. So now y'all can see how it feels to actually do it. And again, bringing it back into the seriousness of CPR from a business perspective, a workplace perspective. It boosts employee morale. You're working somewhere, if they initiate CPR, you're working somewhere that cares about you, your family, and all of that. Because like I said, CPR is not just for the workplace. Once you get your employees certified, they're taking that life-saving skill home.
Right.
So it definitely boosts employee morale. Doing this is actually a team building exercise. So taking a class together as a group, is a team building exercise.
Sounds like it's exercise period.
Yeah, it's exercise. It's exercise all together. And then people become more safety conscious and aware. Like when you do like a CPR class in first aid, you're thinking about other things within your environment, becoming more aware and conscious of, so it definitely can help as far as reducing safety incidents, accidents on the job, and then just being prepared to respond to those. I did ask a few questions about if there's any type of reduction in business insurance or anything. There is, from what I understand, there isn't. But from the perspective of if an accident happens on site at the workplace, and it's due to something at the workplace, let's say maybe some faulty electrical wiring or something, somebody got shocked and they went into sudden cardiac arrest. If somebody's there that can administer CPR, then and actually save that person, then there's cost savings right there, because that could be like a huge lawsuit. Mm-hmm. So you can look at it from that perspective, even though you don't have like a reduced premium or something.
Right.
Yeah, it can definitely save a lot if somebody's able to save a life. And then just overall, people want to know that they're safe in the places that they visit and frequent. So you just have to think about it from that as a business owner. I would like to go and go out to eat and know that, okay, if something happens to me, they have staff that can assist. Or if I'm working out at a fitness facility, they have staff that can assist. They have an AED on site and somebody's trained in CPR. So
I worked at a fitness center several years ago, like early 2000s, and we all had to be certified in CPR and with the device. Like it was,
yeah,
you
that
had
comes
to have
together as
both.
one class.
Yeah.
So when you take a CPR class, if it's a certification class, you're getting certified in CPR and AED. So you will know how to use, fully use the AED. So if anybody wants to come do a full certification class, or if you want to just, message me and want to go through all of this again, because we did it in a kind of condensed fashion, I'll be, gladly show you more.
Thanks everybody for tuning in today for our training and heart health informational session, Topics at 12, with Sonia, who is a part of Hendlee CPR and Safety Solutions. And we are so excited and to have learned here at the Chamber. And if you need anything else, you can contact her or you can contact the Chamber and we'll be happy to share her information. See you soon.